the start of last summer, I broke the scaphoid bone in my wrist and eventually had to have surgery for it. After surgery, I asked the doctor if I needed to have therapy afterwards. He said no. And afterwards, over a couple of months, I noticed that the mobility in my wrist was going away and it was still painful. And if I could choose now, I would go back and I would choose to do therapy immediately afterwards. And if I could choose any clinic to go to, I would choose ATI Physical Therapy. I would also choose to work for them in the future if I could, mainly because of their attention to detail and post-therapy. These are the things that separates them the most. I've gathered a number of sources for info, including American Physical Therapy Associates and their website. I've also job shadowed at a local physical therapy clinic for over 16 hours. Throughout my time, I'll discuss ATI's success with their methods, research-based therapy and the process of it, and ATI Physical Therapy's achievements. For the first one, I'll discuss ATI's success. Their success comes from them hiring productive clinicians and using research-based therapy to the best of its ability. They were named the best physical therapy practice in the nation by Advanced Rehab magazine. They also use electronic medical records to get to patients' info efficiently and quickly. Research-based therapy has become so popular mainly because it finds the most reliable action without too much risk. The process of research-based therapy is number one, evidence, such as what's hurting on a patient, what they can't move. And then number two is using the clinician's knowledge, just finding a clinician who knows the best about maybe which part of the body it is. Number three is finding the patient's goals, seeing what they want to do or how much they want to improve or what kind of mobility they want to get back. And number four is putting forth evidence, which is actually doing the real therapy. An example of this, of using research-based therapy, would be, again, my wrist. Eventually, afterwards, I went to the local therapy place that I job shadowed at and asked for some exercises or something I could do to get my mobility back. And so for evidence, it was just that my wrist wasn't as mobile and it was starting to become painful. And so then they found a therapist that could help me, that knew more about carpals and those types of bones. And my goals were to basically get if I could, all of the mobility back in my wrist. And they gave me a number of exercises to do before bed each night that in the past couple months have improved the mobility of my wrist a lot more than it was after surgery. Some of the achievements of ATI Physical Therapy is they've gained URAC Core Standards accreditation, which is basically an award for clinics and other workplaces that go in the health field. They deal with like cleanliness methods that they use, which is research-based for ATI, how well of results they've had with other patients. The URAC Core Standards last for around 3 years, and it just sets goals for clinics. It's basically like the OSHA of physical therapy. Based on ATI's success and recognition, it's obvious that their methods are reliable, and if I were to work at any clinic, I would have to choose ATI for their attention to results and efficiency. Thank you.
Jeep. You were supposed to press stop.